We're missing a person.
That's okay.
2 people.
It's being recorded.
Or wait, 1. Yeah, 2 people.
I think I got to sit back here and see what everyone's doing. Oh, look, it even has a little logo down there for us.
Oh, that's cool.
Oh my gosh, you better get out there. I will take your audio down. I'm going to face this towards me so I can...
Yeah, that's fine.
Can I say something again?
When should we start?
There you go, right now. We can start now. There you go.
Okay.
All right, I'll check first. Latecomers in.
You guys ready to go? Sure. All right. Dan, I need that clicker.
Oh, yeah. All right.
Is it on?
The last time I was here, he did the presentation. He doesn't want to do this one?
No, he doesn't want to do this one.
No, thank you.
Is it good?
Yep.
Okay. Well, my name is Emily Bronikowski, and I'm one of the pharmacists here. I'm glad to see that a lot of you are here in person, and thank you for everyone that came and everyone that's online. I'm glad to see that so many people want to learn about an important topic like this. We're going to talk a lot about different vaginal health topics and kind of cover a lot of ground. So if you do have any questions, just feel free to ask them at the end. That being said, we're going to have some fun tonight. So this slide, just before we get into the content, it's just meant to tell you that like what I'm about to present on is all based on like experience and some research that I did. It's not meant to substitute like being evaluated by a medical provider and being evaluated and treated. So we always want you to talk to your doctor before starting new medications and supplements. That's what that's saying. This is an outline of everything that I'm going to talk about tonight. So as you can see, kind of a lot of topics. So I'll kind of go through like a summary of the condition, some symptoms, causes, and other risk factors, and then go over different types of treatment and supplementation that can help with the condition. So first we're going to go over like just a quick female anatomy review. Like my goal here isn't to make anyone uncomfortable, but just kind of get everyone on the same page as far as like the technical terms of the female anatomy. So the external genitalia is known as the vulva. This is comprised of the labia majora, which are 2 folds of skin that extend down and back, sometimes referred to as like the outer vaginal lips. The labia minora are the 2 folds on the inside of the labia majora, and that's also referred to as like the inner vaginal lips. The clitoris is covered by the clitoral hood, and that is located at the top of the labia minora. It's a mass of erectile tissue and nerves that's involved in sexual response and can become enlarged with stimulation. And then the urethra is located just below that, and that is where urine comes out. And then the internal genitalia is known as the vagina. And then the area between the labia minora is known as the vestibule. And then the vaginal opening is referred to as the introitus. So just kind of like the terms that are used by medical providers. So the first topic that we're going to cover, it encompasses like 3 different things, is vaginal microbiome challenges. So the first one that we'll talk about is bacterial vaginosis. This one, so the vagina is home to multiple kinds of bacteria, and similar to the gut, it's known as a microbiome. When there's overgrowth of bacteria or imbalance of good and bad bacteria in the vagina, this can cause what's known as BV, or bacterial vaginosis. It can be caused by anything that can disrupt like the balance and of the bacteria and the pH of the vagina. And then some of these examples can be like douching, not using condoms, having new or multiple sex partners, and then also hormone imbalance. It's not a sexually transmitted disease, but it can be associated with sex. And then symptoms of BV include vaginal discharge, pain, itching, like burning when you're peeing, or pain after like peeing or sex. And then the most common is like a strong fishy odor. It's usually frequently occurring in postmenopausal women due to hormone irregularities and just like the general drop in progesterone and estrogen. Women who suffer from recurrent BV are usually stuck in a cycle of symptoms improving, and then they fall into regression, and then usually they'll get prescribed a course of antibiotics. Sometimes this can actually disrupt the vaginal flora and cause more harm than good, just because it can kill off the good bacteria as well. When struggling with BV, it's important to practice good hygiene. Like don't wear clothing that's too tight or can hold moisture, things like that, and avoiding any scented soaps or perfumes down there. In order to fix the problem, it's important to get to the root cause, which is the pH imbalance. So once we can fix that, then usually symptoms can resolve. So this can be achieved a few ways. The first thing you want to be on is a good probiotic. You want to make sure that the good bacteria will have a chance to balance out all the bad bacteria. So a way to do that is through supplementation. It's important to take like a lactobacillus-based probiotic, just because that's one of the most common types in the vagina, and it plays a key role in maintaining vaginal health. We carry a great women's probiotic here, just for that exact purpose. And then another consideration would be to test your hormones, which we also sell test kits for as well. But vaginal irritation can occur when estrogen levels are lowered, which increases the risk for infection. And then those of you who've experienced estrogen drops due to like pregnancy, breastfeeding, hormone changes with menopause, even like surgical removal of the ovaries, you may want to consider testing hormones and looking into hormone restoration. Something that we compound at the pharmacy for this issue is boric acid. As suppositories, they can be used for BV. And the exact mechanism with how they work isn't really known, but it's thought that they have like antiseptic, antifungal, and antibacterial properties. And they can also help restore the vaginal pH. And then like with the boric acid, it's thought that like the acidic portion of the compound can actually penetrate the cell wall and disrupt the cell membrane, which kills the cell. And then urinary tract infections, these are a super common issue. I'm sure everyone's had one. They're common and they can happen when bacteria from the skin or rectum enter the urethra, and this can infect the urinary tract. The infections can affect several parts of the urinary tract, but the most common is the bladder, and that would be called cystitis if you've ever heard that. There's many causes of UTIs, including like previous UTI, any sexual activity, and changes in the bacteria of the vaginal flora. For example, menopause, pregnancy, age, because it's like the younger you are and the older you are, like the more likely you are to have a UTI, and then also poor hygiene. Symptoms include pain while urinating, frequent urination, feeling the need to urinate despite having a full bladder, despite having an empty bladder. You might have like blood in your urine or like pressure or cramping in the groin area. If a bladder infection spreads to the kidneys, this can cause a kidney infection, and that can lead to like fever and like back pain. Usually when someone gets a UTI, antibiotics are prescribed, which, like I said before, can mess up the vaginal flora, and then also anti-inflammatory drugs usually. Many times though, a UTI will go away on its own, even like with supplementation of products. In fact, there's been several studies on women who have UTI symptoms, And one study showed that 25 to 50% of those UTIs got better within a week without any antibiotics and only like supportive care, basically. So prevention is key with UTIs, and it's important to stay well hydrated and have proper hygiene around the urinary tract. And I'm sure a lot of you have heard of like cranberry juice can help with UTIs and things like that. There was actually a study published in 2017 that had 1,500 women that were at risk of UTI, and that showed that cranberry reduced the risk of UTI by 26%. So that's a big number. Vitamin C can also play a role in like helping with UTIs. It's thought that the vitamin C can like combat bacterial growth. It's important to also be taking a probiotic for women's health, kind of as I mentioned before, just to maintain the vaginal flora. And then there's also what's called hibiscus flower extract and berberine. Those can help prevent bacteria from adhering to the bladder walls. And then when that's used in combination with dandelion leaf extract, the dandelion leaf extract can cause like frequency of urination and kind of excrete that bacteria faster and just kind of eliminate the bacteria from the bladder. And we actually have a product that contains the dandelion leaf extract and hibiscus flower and cranberry all in one. It's called UT Defense. It's a really popular one. And it's kind of designed to support like kidney and urinary tract health and kind of help promote that microbial balance. And then, so compounding for chronic UTIs is certainly something that we do a lot. There's a lot of research that shows that vaginal estriol cream, which is a hormone, can be applied to kind of prevent those chronic UTIs, and especially in menopause. It's thought that the estrogen increases the stores of glycogen on the surface of the vaginal epithelial cells, and the glycogen acts as a food source for the lactobacilli, which are the good bacteria of the vagina. And when there's more glycogen, that means there's more of a protective environment. So when women go through menopause and their estrogen levels are reduced, that food source really decreases. So the good bacteria also decrease due to the less protection that they would have. So replacing this estrogen vaginally can be really helpful for patients struggling with chronic UTIs. And then the next microbiome challenge that we'll talk about is yeast infections. Again, very common. A yeast infection is a fungal infection, basically, and symptoms can range in severity, and this can include intense itching and irritation, burning sensation, redness and swelling of the vulva, as well as vaginal pain and soreness, and like a thick, white, odor-free vaginal discharge, kind of like a cottage cheese appearance, and watery vaginal discharge. I know that's exactly what you want to be picturing right now, but that's just kind of the description. So the vagina naturally contains that mix of yeast, including the candida and bacteria. And then certain bacteria, like the lactobacillus, act to prevent that overgrowth of the yeast. But the balance can also be disrupted, and so many things can cause disruption of that balance. And then an overgrowth of the yeast or penetration of the fungus into deeper vaginal cells, like different cell layers, can cause the signs and symptoms of a yeast infection. So some risk factors, like I mentioned before, antibiotic use, that's a big one. Yeast infections are common in women who take antibiotics. Broad spectrum antibiotics are meant to just kill a wide range of bacteria, and unfortunately they can also kill the good bacteria in your vagina, and then that leads to the overgrowth of yeast. And then, so actually increased estrogen levels, yeast infections are more common in women with high, like really high estrogen levels, such as pregnant women or women taking high-dose estrogen birth control pills, or even just like estrogen hormone therapy that's really high. That's why it's important if you are using hormones to get your levels tested and make sure that you're within that optimal range. Also, uncontrolled diabetes is a big one. Women with poorly controlled blood sugar, they're at greater risk of yeast infection than someone who has good blood sugar control, just because yeast loves sugar, so it'll grow easier. And then women with an impaired immune system, usually with lowered immunity, such as like corticosteroid therapy or like autoimmune diseases, they're more likely to get yeast infections. So prevention of yeast infections involves kind of the same as BV, like avoiding the wet or tight clothing, clothes that can hold moisture, avoid douching, and then any unnecessary antibiotic use. And then supplementation can always help. So with the probiotics that are formulated for vaginal health, like I said, it's always a good idea when you have any microbiome issues like that to just supplement with that. And then berberine has also been shown to have antimicrobial and antifungal properties. So there's various studies that show that it's highly effective against the Candida albicans, which is what causes the main yeast that causes yeast infections. And then we have a product called cystostatin that has the berberine with the unique botanical blend to kind of maintain that healthy urinary tract. It's called cystostatin. Yeah. And then turmeric has also been shown to be to have those antifungal properties as well. There's a number of studies that have pointed to turmeric's efficacy with both Candida albicans and the biofilms that it forms. So I thought that was really interesting because usually you see that for like pain and things like that. And then we can of course compound for yeast infections. Like I mentioned before, boric acid is a good option because it does have those antifungal and antiseptic properties. And that can be made into a cream or a suppository. And then another option, which is usually not one of the first things that providers will try, usually like down the line, is called amphotericin B. This is a very strong antifungal agent, and it binds to the fungal cell membrane and leads to cell death of the fungus. And that can also be made into a cream or a suppository. Something new that we are offering is vaginal microbiome testing, so that's really exciting. As we know, the vagina has a dynamic ecosystem, and the main function of that is to keep the vagina at an acidic pH. Unlike our gut, the vagina thrives on like low microbial diversity and lactobacillus dominance. So disruptions in the vaginal microbiome are common, and they can lead to the unwanted microbiomes or unwanted microbes. So we have this test available to us that allows you to test your vaginal microbiome just in the comfort of your own home. And it's just a vaginal swab. And then that gets sent off to a lab and they analyze it. And with that information that we find out, we're able to provide like nutrition and lifestyle and supplement recommendations all in one. And that's all based on your vaginal microbiome. So that's really interesting. And then it tests for all the lactobacillus species and then like 26 of the opportunistic bacteria that are known to cause disruptions in the microbiome. And then it also tests for Candida, which is that yeast. And then, so this is an example of one of the pieces of like the test reports. There's actually like several parts to it. I just kind of included this one because I thought it was interesting. Kind of breaks down like each microbe that is in there and like what levels it's at. And then it further goes on to show like which ones are good bacteria and bad bacteria. And then so there's 5 categories that you can be placed into based on this, and that helps determine like which microbiome you have, and then like which strains are more dominant for you, and helps with guiding like therapy, and then makes next steps easier. Next, we're going to kind of touch on some intimacy topics. So the first one is sexual dysfunction. This is kind of just like a broad term for a lot of different things. Sexual dysfunction can be defined as persistent, recurrent difficulty with sexual response, desire, orgasm, or even pain during sex. It occurs when you have a problem that prevents you from either wanting or enjoying sexual activity. Can be caused by many things such as like stress, trauma, alcohol use, even medications that you're taking, and then even relationship issues and hormone changes like with pregnancy, breastfeeding, menopause. And there's 4 different categories. And let me just say, it's normal to not be in the mood sometimes. This is only considered like a disorder unless it's only meant to be considered a disorder if it's like constant recurrent problem, happens regularly and significantly affects your sex life. So the first one is desire disorder. This is when you have like little to no interest in sexual relationships on like an ongoing basis. And then there's arousal disorder, which means like you're emotionally in the mood, but really just physically your body's not into it. And then orgasm disorder means that you're emotionally in the mood, but you have like an inability to climax, which can leave you frustrated. And then pain disorder, kind of what it sounds like, you just have pain during intercourse. And then low libido is usually caused by hormone imbalances. We see this all the time. Having low testosterone can cause low sex drive and low desire for anyone, really. So treating sexual dysfunction can be kind of tricky. First, we want to make sure that we're doing everything psychologically that we can be to be in the mood. This involves like reducing stress and anxiety and having good communication with your partner. It's also important to note that, like I said, certain medications can cause sexual dysfunction. So like there's some anxiety or depression medications, antihistamines, certain blood pressure medications even, and then many others. So if you are experiencing this, you might want to look at your medications. You can talk to your pharmacist or your provider just to see if any of those could potentially be causing or affecting your sex life. And then probably the most important treatment, like I said before, you want to test your hormones, just kind of see like where things are at. And then restore them if your levels are low. So when estrogen and testosterone are low, this can cause low desire and inability to like get aroused. Another option would be oxytocin. This can be in the form of like a nasal spray, dissolvable tablet, or even a vaginal cream. And oxytocin is known as like the love hormone. So it's released, it's like those warm fuzzy feelings like when you're in love, you know. It's also released during sex and can help with achieving an orgasm. And then another option would be arousal cream, which is applied directly to the clitoris. It's also known as scream cream, so you can use your imagination as to why it's called that. So this is a combination of like vasodilators that increase vaginal blood flow and increase like stimulation and response. And then, like I said, it can just increase like sensitivity. So it can be used like as needed, but sometimes when you're first starting on it, they want you to do it like once or twice a day. It can be used like a lot of different ways. And then actually a supplement that's shown to help support sexual dysfunction is fatty acids. These have like an anti-inflammatory effect and can help with heart health, which promotes healthy blood flow, which you need in order to have a sexual response. And then we also have a product called Bliss. It's a lubricant that has CBD in it. So your vagina has a lot of cannabinoid receptors in it, which I didn't even know before I started working here. And so this intimate oil can help like relax the body and mind and like stimulate pleasure and increase blood flow. And it just kind of decreases discomfort. And it also has like peppermint and black pepper in it, which can give like the heating, cooling sensation. And I actually have free sample packets as well if you guys are interested after. I can give you some. So yeah, that's sexual dysfunction. And then vaginismus. this is kind of something that I had also never heard of before, but it's actually pretty common. It occurs in like 1 to 6% of women. It's when the vagina and surrounding pelvic floor muscles like suddenly and involuntarily tighten up. And that's usually just when trying to insert something in it. So some women describe it as like their vagina turning into like a brick wall, kind of just upon like anticipation or initiation of penetration. So whenever penetration is attempted, like the vaginal muscles tighten up and it's all on their own, like you have no control over it. And occasionally you can get vaginismus even when you've previously enjoyed like painless penetrative sex. Vaginismus doesn't necessarily affect your ability to get aroused and enjoy like other types of sexual contact, but can mostly just revolve around like penetration. People can experience this at the start of sex or like when inserting a tampon even or getting a pelvic exam, so it's not just like sex related. And then this can make intercourse obviously very uncomfortable and sometimes not even possible. The reasons for vaginismus are not always clear, but there's some things that are thought to maybe cause it, like fear of the vagina being too small, or like a bad first sexual experience, unpleasant medical examination, believing sex is shameful or wrong, complicated childbirth, and then like sexual assault. Management for vaginismus includes like cognitive behavioral therapy and then pelvic floor therapy to kind of help stretch and relax those muscles. And then even vaginal dilator therapy, which involves like different size dilators that are made of silicone that are used to stretch those vaginal tissues gently and progressively with different sizes. And then relaxation techniques such as deep breathing and mindfulness, those are important because they can help you relax. And then most importantly, there's creams that we can compound that can help with pain and relaxation. So these are kind of some of those options. Treatment is so important with vaginismus because without it, it won't go away. And then usually it's as like an adjunct to physical therapy and or cognitive behavioral therapy. These compounded creams have been life-changing for patients because even a like small improvement in symptoms can make a huge difference. We make creams that include lidocaine, which is a numbing agent, and then ketamine and amitriptyline. They both work to provide pain relief by pain relief and muscle relaxation by blocking transmission of those nerve signals and reducing the sensation of pain. And we can also include things like diazepam and baclofen, which are muscle relaxers, and those can help relax the vaginal muscles and reduce anxiety. So we kind of touched on this a little bit, but next we're going to talk more about vaginal pain and like discomfort. So the first topic is vulvodynia. This is a chronic pain or discomfort around the opening of the vagina or the vulva, and for which there's no identifiable cause. And this can last like at least 3 months. So the pain or burning and irritation associated with this can make you so uncomfortable that you can't even like sit for long periods of time, and sex is just like unthinkable. And the condition can last for, like I said, at least 3 months to years. And this involves like complex neuropathic pain that includes burning, soreness, stinging, rawness, painful intercourse, and throbbing and itching, and it's just really miserable. Often things can actually look pretty normal, if not like a little red or inflamed. So that can be kind of deceiving because you're like, what's going on? But pain can also be constant or occasional or only when touched. And then it can range in severity as far as pain level among patients. Some possible causes include hormone changes, like with anything else, spasm or weakness of the pelvic floor, and then allergies or sensitive skin. Some risk factors include sleep disturbances, other chronic conditions, and other like psychological disorders such as PTSD. And then treatment usually involves stress reduction, since stress makes the condition so much worse. And then avoiding skin irritants like deodorants or perfumes, as well as activities that put pressure on the area like horseback riding or biking, things like that. And then applying a lubricant if sexually active is really important, just to help reduce irritation. And then of course we can compound vaginal creams for pain and discomfort like I mentioned before, while lidocaine cream applied to the vestibule prior to intercourse may reduce provoked pain for some patients. Other treatments may be necessary for more severe pain. So we can do like gabapentin, amitriptyline, ketamine. Those have all been used as well due to their ability to reduce those pain sensations. And then we can also compound the vaginal estrogen cream, and that helps with the vulvodynia symptoms that are associated to hormone changes, like through menopause and things like that. And then so topically applied estrogen is used to prevent the tissue of the vagina from becoming thin and dry, and it can also work externally. The use of estrogen cream can increase the thickness of the tissue and kind of reduce some of the discomfort that comes with the effects of the decreased hormone production. And we can also make that cream in like a lubricant base as well. We have some patients on that they find that helpful instead of just like the cream base, because they can use it as a lubricant. And then the next topic is vaginal atrophy. This involves thinning and drying and inflammation of the vaginal walls, and that may occur when your body has less estrogen. So it's most common after menopause, like with some of these other ones. It's usually due to hormone changes. For many women, the vaginal atrophy not only makes intercourse painful, but also leads to like distressing urinary symptoms as well. So symptoms can include vaginal dryness, discharge, itching, burning, and then urgency with urination and then frequently urinating, recurrent UTIs, urinary incontinence, so a lot of symptoms involving the bladder, and then even light bleeding with intercourse, and then decreased vaginal lubrication during sexual activity. So the main cause of vaginal atrophy includes a drop in estrogen. So whether that's from menopause, perimenopause, breastfeeding, surgical removal of the ovaries, or taking medications that decrease estrogen production, and after chemotherapy for cancer. So there's many things that can cause your estrogen to drop. Some risk factors include being a woman over 50, since this is usually when menopause is setting in, and smoking. Even no vaginal bursts can be a risk factor, as well as no sexual activity. So like smoking affects your blood circulation and can lessen the blood flow and oxygen to the vagina, and it reduces the effects of the naturally occurring estrogens in our body. And there's actually been a little research that shows that women who've had no vaginal births are more likely to develop these symptoms. They're not totally sure why, but it's just like some risk involved. And then, so sexual activity increases the blood flow, so that can actually be a risk factor if you're not having sex, believe it or not. So prevention and treatment usually include, prevention and treatment include regular activity, or regular sexual activity actually, to like increase that blood flow. So the more sex, the better. I bet you didn't think I'd be telling you to go have sex tonight. So using a personal lubricant can also help with dryness. So like I said, we can make the estriol creams in a lubricant, or you can just apply like a regular lubricant. And then vaginal applications of the hormones are going to make the most difference for these patients, just because when we're restoring those hormones to normal levels, it'll usually resolve symptoms. And then one of the lubricants that we carry here is called Flora Balance Gel. It contains a moisturizing seaweed and full spectrum hemp extracts to soothe the vaginal dryness and discomfort, while arginine and ginseng heighten the sensations during intimate moments. As the name suggests, it also balances your vaginal flora. It has a prebiotic in it to restore that microbiome to a balanced state. And then it can also be helpful for all of those microbiome challenges that we discussed earlier. And like I said, it can also be used as a lubricant, which is nice. Compounding for vaginal atrophy, some options include like estriol, estradiol, or DHEA, which is another hormone, in combination or just one thing, usually in the form of like a tablet or a cream, a vaginal tablet actually. It's like the size of like a eraser on a number 2 pencil. It's really nice. And then that can be applied directly to the source. Usually when you're having those vaginal symptoms, it's best to apply directly to the source. Estriol has a higher affinity for the reproductive tract and the urinary tract, and it's usually what I recommend for these patients. Hyaluronic acid and or vitamin E can be helpful in relieving vaginal dryness since they act as like natural moisturizers. And then, so these options can restore hormones and provide relief to symptoms of vaginal itching, dryness, and can also improve skin integrity and elasticity. The next topic we're going to talk about is high-tone pelvic floor dysfunction. So your pelvic floor is a group of muscles that supports all of your pelvic organs. So such as your bladder, your vagina, your uterus, all of those. Your muscles in your pelvic floor connect to your pelvic bones to form a strong yet flexible foundation. And these nerves and muscles help control urination, bowel movements, and even sexual function. High tone, or also known as hypertonic pelvic floor dysfunction, is a condition where the muscles in your lower pelvis are in like a state of constant contraction or spasm, and this can be either temporary or it can be constant. When your pelvic floor muscles are in this state, they can't relax and they can't control and coordinate your certain bodily functions appropriately. So this can cause pain, problems with urination and bowel movements, as well as sexual dysfunction and painful intercourse. Symptoms can be either specific to a location like your bladder, or it can be more general, like general pain or pressure in your pelvic area. There's 3 groups of symptoms. So there's urinary, bowel, and sexual symptoms. The urinary symptoms include like general bladder pain, pain while urinating, frequent urination, and then like difficulty starting or maintaining a urine stream. Bowel symptoms can include difficulty starting a bowel movement, or feeling like you're unable to empty completely, or pain during or after a bowel movement, and even constipation. And then sexual symptoms include mostly pain during or after sex, and then inability to orgasm. And these symptoms usually develop slowly and get worse over time. So it can actually be caused by holding in like your urine or your bowel movements too long. It can be caused by injury or trauma to the pelvic muscles, during surgery, pregnancy, or even childbirth is a common one. Muscular dysfunction caused by prolonged sitting, abnormal posture, or even like walking funny, or uneven pelvic bones, that can all cause pelvic floor dysfunction. Can also be caused by other pain-causing conditions like IBS, endometriosis, vulvodynia, anal fissures, and painful bladder syndrome. Stress, depression, and anxiety also have a role in causing pelvic floor dysfunction, so that's also something to pay attention to. So to help reduce your risk of hypertonic pelvic disorder, You can practice mindfulness and relaxation techniques. There's a lot of different pelvic floor exercises and like yoga positions that can help relax and strengthen your pelvic floor muscles. It's especially helpful if you're pregnant or you just had a baby to be doing these, because you carry a baby for 9 months. That puts a lot of pressure on your pelvic floor, and then you go through childbirth. It's just a lot of stress on the pelvic floor. You really want to avoid long periods of holding in your urine or bowel movements, because this can also cause stress to the bladder or colon or even the pelvic floor. And then the good news is that it's treatable, and although it can take some time and patience, most people have a partial or complete relief of symptoms with treatment. So the primary form of treatment is physical therapy. Usually we just see that to help retrain those muscles. During a physical therapy session, you might go through different techniques, different poses, and learn how to contract and relax your muscles in your abdomen and your pelvis, just so that that muscle stretching and strengthening can happen. And then acupuncture has also been shown to relieve some symptoms. There's a few case studies that show acupuncture can be effective, like in conjunction with physical therapy. The acupressure points that they use are located around like the hips and spine area. And then compounding options for pelvic floor dysfunction include diazepam with or without baclofen. Diazepam can work locally to reduce the pain and cause a calming effect, without the same side effects as oral diazepam, which can make you pretty drowsy and kind of feel out of it. And then baclofen, these are both muscle relaxers, but that can be included to work to reduce those muscle spasms. Can be made into suppositories and that are inserted vaginally or rectally, or it can be made into a cream to apply. And then another option for pain for pain associated with pelvic floor dysfunction is low-dose naltrexone. Dan actually has a great video on the MDCUSTOMRX YouTube page that shows like low-dose naltrexone and the many benefits that it has. But it can be used for many kinds of pain symptoms, including like bladder and pelvic pain, and can be added to a suppository for pain relief with something like diazepam or amitriptyline. And then vulvar lichen sclerosis. So this is a chronic inflammatory condition that causes patchy, discolored, thin skin and usually affects the genital and anal areas. I tried to include a tame picture for you all to kind of like get an idea. It isn't contagious and it doesn't spread through sexual contact. Symptoms include like smooth, discolored skin patches, wrinkled skin, itching, soreness and burning, easy bruising, fragile skin, bleeding, lots of different things. And so the exact cause is not known, like for a lot of these, but it's likely from a combination of things, including an overactive immune system, your genetic makeup, hormone imbalance, and then previous skin damage or any irritation that you might have. And anyone can get this, but postmenopausal women are at the highest risk. Risk is also higher in children younger than 10, and then women who have an autoimmune disorder or even thyroid issues. There's also a genetic component, so if there is family history, the risk is much higher. Treatment usually involves a steroid ointment called clobetasol, and you can usually apply like Vaseline or Aquaphor to the area when it's clean and dry, and this might help with some irritation. Sometimes patients don't respond to the clobetasol, so the next step in therapy would be something called tacrolimus, which is an immunosuppressive agent. And there are actually studies that showed patients that did not respond to clobetasol, that tried the topical tacrolimus, went into full remission or at least showed great improvement of symptoms. So I thought that was pretty interesting. And then another option includes vaginal testosterone. There was a study that was done with 10 women that had VLS, and they all showed improvement in symptoms except one patient who actually had elevated testosterone levels prior to treatment. So that kind of suggests that if women who have normal testosterone levels try this treatment, they are likely to have success with the vaginal testosterone. We have to be careful applying testosterone vaginally just because that can cause like hyperandrogenism, which includes like enlargement of the clitoris and alterations in voice. And then another option to consider is the naltrexone again. So although there's no clinical trials to show its effectiveness, we know that LDN is useful for many inflammatory conditions and autoimmune disorders. So it would definitely be worth considering for VLS patients as well. And then next we'll talk about some uterine disorders that are kind of common. The first one's going to be PCOS, which stands for polycystic ovary syndrome. This is a condition in women where the ovaries produce like an abnormal amount of androgens, which are the male sex hormones. And the name polycystic ovary syndrome describes like the numerous small cysts or fluid-like sacs that form in the ovaries. And however, some women with the disorder do not have cysts, while some women without the disorder do have cysts. So you can't really like classify it based on like whether they have cysts or not. In some cases, a woman doesn't make enough hormone to release an egg during ovulation. And when this doesn't happen, the ovaries can develop those small cysts. These cysts then make androgens, and often these women with PCOS have high levels of androgens as a result. This can cause many problems for her menstrual cycle and actually causes like a lot of the symptoms of PCOS. The exact cause isn't known or clear, I'd say, but many of these women have insulin resistance, and the insulin can build up in the body and cause higher androgen levels. Obesity is also common and can increase insulin levels and make symptoms worse. However, some women are not obese and show no signs of high androgen levels. So they usually don't find out that they have PCOS until they're struggling with infertility, and they go in to find out what could be going on, and then they're like, oh, you have PCOS. So there's also a genetic component to it as well. It's pretty common for both a mom and daughter or sisters to all have PCOS. Symptoms of PCOS are mostly symptoms of high androgens in females. So this can include like missed periods, irregular or light periods, excess body hair, including like chest, back, and stomach. That's also known as hirsutism. And then weight gain, especially around the abdomen, like oily skin or acne, baldness, thinning of hair, those things. Like I said, infertility, skin tags even, like dark spots on like the neck, armpits, and under the breasts is also common. And then, so risks of PCOS include type 2 diabetes, high blood pressure, heart problems, endometrial cancer, and infertility. So treatment can depend on if you're trying to get pregnant or not. Usually diet change is like the number one thing, and exercise that's going to be beneficial for everyone. And even a 5% reduction in weight can improve the condition a lot. Losing weight can also increase the effectiveness of the medications that they're going to prescribe for like fertility. And then these medications you can take to help with ovulation. Usually it's like clomiphene, letrozole, or like gonadotropin injections that patients would use. Controlling your menstrual cycle is also really important for PCOS because regulating your hormones can lower your risk of endometrial cancer and correct any irregular bleeding and excess hair growth and acne and all the signs that someone looks like they have PCOS. Birth control pills might be recommended by a provider. Usually the ones that contain like estrogen and progestin can help decrease that androgen production and help with symptoms. There's also progestin-only birth control pills that are taken like 10 to 14 days a month, and that can help regulate periods. Metformin can also be used to improve insulin resistance and lower insulin levels. Can also help slow the progression of like prediabetes to type 2 diabetes, and can help with weight loss. Spironolactone is another thing that might also be recommended. This is an oral agent that's anti-androgen medication that works by blocking androgen receptors, which prevents testosterone from binding and exerting its hirsutism-causing effects. Acne treatments might also be recommended to help with any like oily skin or acne. And then as far as compounding, what we can do for PCOS, there's a few options. We make topical metformin that you would apply to your skin, usually twice a day. We do this a lot, and the dose is actually about 10 times lower than the oral dose. And usually with the oral metformin, you get a lot of GI upset, diarrhea, things like that. So people really don't like to take their metformin, you know. Yeah, so usually the topical metformin is just like a much better option. It bypasses the stomach, and you don't get those GI side effects. And then another option is that progesterone. We're able to compound this as capsules, rapid dissolve tablets, vaginal and topical creams. Progesterone's great for regulating the menstrual cycle, as I mentioned before, and progesterone also has like anti-androgen effects, so it can help provide relief of symptoms from PCOS. And then we also do a lot of topical acne medications with agents such as spironolactone that can help with the anti-androgen effects as well. Recently, we've been doing a little bit more topical finasteride for women. Can be used as a facial cream to kind of prevent like hair growth on the face. So finasteride is a 5-alpha reductase inhibitor, which blocks those androgens, and it blocks the conversion of testosterone to DHT, which is a stronger form of an androgen that is responsible for the development of those male characteristics such as facial hair and body hair, things like that. And then there's also an inflammatory component to PCOS too. So naltrexone could be helpful there as well. Just to kind of reduce the chronic inflammation and even help ovulation to occur by reducing that inflammation. And then it can also like modulate your body's immune system over time and can boost like your body's natural production of the endorphins while decreasing that inflammation related to the disease caused by those pro-inflammatory cytokines. And then the next topic is endometriosis. Endometriosis is often a really painful disorder where tissue similar to the endometrium grows outside of the uterus. So the endometrium is that tissue that lines the inside of your uterus, which sheds when you have a period. And this usually affects the ovaries, fallopian tubes, and the tissue lining the pelvis. In some rare cases, the endometrial-like tissue can be found outside of the area where the pelvic organs are located. The tissue acts just like the endometrial tissue would. So it thickens, it breaks down, it bleeds with each menstrual cycle. And then since this tissue has no way to exit the body, it kind of becomes trapped. So when the ovaries are involved, cysts called endometriomas might form. Surrounding tissues usually become irritated and develop scar tissue. And then adhesions, which are bands of fibrous tissue, can cause pelvic issues, and they kind of like stick to those tissues and organs and just kind of all stick to each other. So I thought that picture showed it, but it doesn't. And then endo is usually associated with severe pain, like I said, especially during menstrual periods. So pelvic pain and cramping with like lower back and abdominal pain is common and may begin even like days before and extend several days after a period. Pain during or after sex is common, unfortunately, and then you're more likely to experience pain with bowel movements or urination during a period. Excessive bleeding can also occur, or bleeding between periods is really common, so just like a really irregular cycle. And then infertility is sometimes how endometriosis gets diagnosed. Like couples go in, like they're having infertility issues, and then they can find out that the woman has endometriosis. Other symptoms can include like fatigue, diarrhea, bloating, constipation, nausea, especially during a period. And then like pain is not always a great indicator of severity. Someone can have like really severe pain with mild disease, or they can have like mild disease with, or sorry, opposite, or yeah, you know what I mean. So it doesn't indicate like how bad their disease actually is. So it can sometimes be mistaken for other conditions that cause pelvic pain, such as like ovarian cysts, pelvic inflammatory disease, and even IBS. So the exact cause isn't known. However, there's some theories. One of the theories is retrograde menstruation. So that includes when like the menstrual blood containing those endometrial cells flows back into the fallopian tubes, and then it's like in the pelvic cavity instead of getting out of the body. So that's kind of how those tissues or those cells get there. And then these cells stick to the pelvic walls, and then also the surfaces of those pelvic organs, where they continue to grow and thicken and bleed and just kind of start this cycle. And then another theory is surgical scar implantation. After a surgery such as like a hysterectomy or a C-section, these endometrial cells might adhere to the surgical incision site. Endometrial cell transport theory says that the blood vessels or lymphatic system may actually transport these endometrial cells to those other parts of the body. And then immune system disorder theory says that there could be a problem with like the immune system, where like the body is unable to recognize and destroy these endometrial-like tissues that are growing outside of the uterus. So there's several risk factors that put you at like a greater risk of developing endometriosis, such as like never giving birth, you start your period at an early age, or you even go through menopause at an older age, short menstrual cycles that last like less than 27 days, heavy menstrual periods that last longer than 7 days, having high levels of estrogen, one or more relatives with endometriosis. There's a lot of like genetic variability with a lot of these, and then other reproductive tract disorders. Treatments like NSAIDs, like ibuprofen and naproxen, which are anti-inflammatory agents, are usually prescribed to relieve pain and like ease those menstrual cramps. When you take them by mouth, you can get those GI upset and like risk of like stomach ulcers, which we don't want to see. So we're able to compound like a vaginal ibuprofen suppository for the pain related to the endometriosis. And it dissolves quickly, provides fast relief, and it eliminates the potential stomach upset that you can get with that oral ibuprofen. Regulating hormones is also an important part. With endo, there's too much estrogen being produced by the body, which can cause that overgrowth of tissue. Progesterone is needed to prevent some of that overgrowth, since it works to oppose the effects of estrogen and kind of keep things in balance. So getting your hormones tested to see what your levels look like would be a good idea if you are experiencing some of these symptoms. And then usually from there, you'll likely be on progesterone therapy just to kind of keep those estrogen levels in check if they are high. And then usually there's a deficiency in progesterone, like I mentioned. So that's why it's important to replace the hormone, and preferably with bioidentical hormones, meaning they're the same as your body produces. And then, as I said before, we can make progesterone as like a topical cream, vaginal cream, rapid dissolve tablet, capsule. We can do a lot with that. And then, so regulating the menstrual cycle with progesterone is beneficial and can help reduce those symptoms. Fertility treatment, just like I discussed with PCOS, is also usually an option if someone's trying to get pregnant. And then in extreme endometriosis cases, hysterectomy with removal of ovaries was once considered like the most effective treatment. However, like more experts are focusing now on just like careful and thorough removal of that endometrial-like tissue. Having your ovaries removed results in menopause. So the lack of hormones produced by the ovaries may improve endometriosis pain for some, but for others, endometriosis pain remains even after surgery, and it continues to cause symptoms. And then early menopause also carries a risk of like heart and blood vessel diseases and certain metabolic conditions and even early death. Another newer option that you can get without a prescription is a full spectrum CBD cream that's inserted vaginally. We carry this over the counter. It's called Endo Relief Cream. There are usually, so like I said, there's many CBD receptors in like the reproductive tract, and this can actually help relieve some of the pain associated with endometriosis and can be used daily or just as needed. For best results, you want to try and lay down for at least like 10 minutes after you use it, or you can use it like at bedtime, that's fine. So kind of just a summary. So there's many vaginal conditions. We only touched on a few of them. There's a lot of others that I didn't cover, or like different aspects of each topic that I didn't go as in depth with. There's really not enough education about these women's health topics as there should be, which leaves so many women kind of in the dark. Like they're wondering like if their symptoms are normal, or like, I mean, I guess like, and then by not talking about these, it kind of like makes it worse, because women like won't seek treatment. They'll think like either they're too embarrassed, or they'll think it's normal and that's just something that they have to deal with. So definitely if you're experiencing any like symptoms that you feel are not normal, or you just have questions, definitely seek help from a healthcare provider. And then finally, I hope that you really enjoyed this, and I hope that you can see how prescription compounding is playing an important role in maintaining and supporting and restoring vaginal health. And like I said before, I'm so glad that you guys came tonight. It means a lot to me, and I hope that you learned something. And does anyone have questions? Sure. Does anyone have questions? I covered it all so good. Yeah?
So some of my friends who I am at the age they are have said to me that you at my age can have a bladder infection and not know it. You don't have pain, you don't have the symptoms that you said.
Mm-hmm.
And a couple of them said that they were like dizzy and not thinking well when they went into the doctor or the emergency room. They had a bladder infection.
Yeah. So the question, I'm just going to repeat it for the live stream, was so a lot of like older women can have like, they may have like UTI symptoms and bladder infection and not even show symptoms. That is pretty common. Like usually the most common reason for someone to go in, especially when they are older, is just altered mental status. And a lot of times like they kind of get used to those symptoms of like having a UTI, which is pretty unfortunate, but that's kind of where that's from. But yeah, as far as like not feeling anything, like I'd have to look into more of that, but yeah, it's a great question. Obviously concerning.
And I know my mom is 90, gonna be 94 in a couple months, and that's just, something that plagues her, and
Yeah.
it's scary because, when you're dizzy and unbalanced and you're that age,
Mm-hmm.
I just wondered, is there something she can have at home instead
Yeah.
of having to go get, checked?
Right, and a lot of that is due to like the vaginal atrophy. Like the urethra actually gets like shorter, so bacteria can get in there like a lot easier as we age. So that's where a lot of that comes in. Yeah.
So there's not something that can be at home for her just to grab when she's getting symptoms?
I mean, definitely like supplementation like is not gonna hurt her. Like I said, we have that UT Defense, which people usually take like acutely, or the cystostatin can be taken every day just as like prevention. It might not be a bad option.
What did you just say?
So UT Defense is a good option for like if you are feeling those symptoms and you just want to kind of take something and then the cystostatin, that one is more for like prevention.
Can this be for men too, get UTIs, or is it okay women?
Yeah, I mean, usually when men get UTIs, it's more of like a complicated UTI because like their urethra is longer than ours. So usually if men get UTIs, it's like, you might want to go in. Yeah. Any other questions?
Is a prescription needed from a medical doctor for the compounding cream?
For compounding, yeah. For all the supplements that I talked about, no. But we have a list of providers that we see a lot from. We can get you that if you're interested. But yeah, for the compounded stuff, yeah, prescription's required.
This thing that you say is the sample, what is that?
Oh yeah, Bliss.
Yeah.
Yes. So that's more of like an intimate oil. So you can use it as a lubricant to kind of help like increase sexual response and like obviously vaginal dryness. And it has like that peppermint and like pepper to kind of give like a heating cooling effect. Yeah, I'll get you one. Any other questions? Yeah.
So, I can't remember if we talked about this. I'm sure you did, I was taking notes.
No worries.
Right fast enough, but you mentioned vaginal dryness numerous times,
Mhm.
but if you don't have that, but you have more the other where there's more moisture. What is
Oh.
that?
So that can also happen. So the question was if you aren't experiencing dryness, but you're experiencing, I'd say, more wetness, right? That can kind of happen with like those microbiome disorders. So sometimes like your biome could be off a little bit and it's just causing like more. So the vagina is like, it cleans itself, you know? So like if there's something in there that it wants to get out, it's gonna get it out. So that's probably likely.
Is that a good thing?
I mean, it's a good thing that it's getting it out, but if it's like a regular problem, then I'd maybe look at it.
Well, so I do go to a gynecologist.
Right.
That's what she is. I brought that up, but it doesn't go anywhere.
Okay. Usually it's the opposite problem that we see, so yeah.
Okay.
Is that a part of the probiotic would help with something like that?
Yeah, definitely. And the probiotic can be inserted vaginally or it can be taken by mouth. It'll dissolve vaginally. So that's really cool.
So that was the other thing she told me was that when we get this old,
Mhm.
that particular, because she said, the particular probiotic that is normally there, like younger women, it's just there. But when you get older, it's not there. And it doesn't stay there. You can't keep it there.
Right, and that's from that estrogen depletion. So like the estrogen kind of has that film that your bacteria need for that like food, and it kind of offers that protection. So once that estrogen drops, then those bacteria also go away. So that's where like hormone restoration comes in.
Even when you're older?
Yeah.
Not dangerous?
I mean, the risk of applying hormones vaginally is pretty minimal. There's a lot of research on that just because it stays mostly where you're putting it, like in the reproductive urinary tract. So we see so many patients that are on that.
And the amount of estrogen is so low compared to the estrogens that were a problem years ago, or, right, you know, where we used to worry more about estrogen. Taking estrogen and then getting breast cancer, basically.
Oh, right, yeah,
Is that the kind of
yeah,
thing?
Right.
Yeah, so different than,
Right.
yeah.
because I,
It was brought up twice to me by a physical therapist and the gynecologist.
I know I'm on estrogen and 66, and it's just, you know, it really, I can see the difference when I wasn't on it,
Mhm.
you know, as far as opposite, you know, more for
Right.
dryness, you know, I can see, wow, it just really helps with lubrication.
Oh, good.
It makes huge, you know, it seems like that's what's
Yeah,
making the difference.
for sure. Anything else? All right.
I'm sorry, I guess I'm a little confused. So you're saying, like, I am a breast cancer survivor, so I hear the word estrogen and all red flags go up, of course.
Right.
So you're saying that if I applied estrogen in a cream, I don't have to worry about it feeding my the
So
cancer
usually
cells?
vaginally, it's not an issue. When you're applying topically, you want to have that progesterone to kind of keep it in check. Dan actually has a great video on his YouTube channel that explains kind of a lot of that. So it might be something to check out, just more than I can explain right now.
Yeah, I'm definitely in progesterone. You're gonna have estrogen.
Yeah.
You know, well, I take it orally.
If you use that, do you feel like you're getting like your period or something? If you feel like you're getting bloated, or does it affect you like that at all? No.
I sleep so well.
Oh, I don't
It's
mean from sleeping.
Yeah,
but-
see, I did back,
Well,
that's
did
why I first went on, I was up all night, and one couple nights on progesterone, just sleeping right away. But, I really have no bloating, but I know I hear a lot of women that, you know, it's just so individual. For me, it's just wonderful.
So did you say you use the progesterone cream too? Or,
Orally, but I use progesterone.
oh, yeah.
um,
Where's orals? On your skin?
Take
Oh, in your mouth, okay.
Oh, yeah, or is the cream, I'm sorry, I take it to
Done that for
cream here,
years.
yeah, compounded cream here,
Mm-hmm.
and testosterone cream,
Is that confirmation of the
all three, progesterone, no, they're all, you know, separate, but I take all three.
Okay.
Yeah. Hormone replacement, yeah. The HR treatment or.
Mm-hmm.
There's a question online that says if you can address uterine prolapse.
Oh boy, uterine prolapse. I feel like that's another whole topic. Yeah.
That's what I was thinking too.
Yeah, maybe we can do like a short on that or something, or like a short video. We'll put that on there.
So yeast can be from estrogen, though?
From a decrease, yeah. Or actually, sorry, too high of estrogen, yes. Yeah, so that's why it's important to just check your levels once in a while. Some doctors will like put you on hormones and like never check your levels again, which is pretty scary. But
Yeah.
mostly the doctors that we work with, they're testing hormone levels, so.
Tested.
All right, cool. Anything else? I'll stick around too if you do have questions. All right, well, I can get whoever some samples if you'd like.